Iron deficiency anemia is a common diagnosis in women of childbearing age all around the world, even those that are not pregnant. During pregnancy, many factors contribute to the increased risk of iron deficiency leading to anemia. These factors include an increased plasma volume leading to physiological anemia, as well as increased iron requirements for fetal red blood cell production and fetal placental development. Pregnant patients are screened for iron deficiency anemia at their first prenatal visit. They are also screened for hemoglobinopathies to identify and counsel those patients whose offspring have a risk of inherited globinopathy. Iron studies include measuring iron, transferrin iron binding capacity, hemoglobin, and hematocrit. In this case, a patient with a history of iron deficiency anemia presents to the hospital at 26 weeks gestation with iron deficiency refractory to oral iron supplementation. The patient was admitted to the hospital for high-risk pregnancy and scheduled delivery due to a small cervix. At admission, the patient was asymptomatic and fetal movements were normal. This patient's initial iron study findings were persistent with a mild to moderate anemia. The patient began oral iron supplementation, but presented at 26 weeks and 1 day gestation with persistent iron deficiency anemia. Further workup revealed the presence of an iron absorption disease secondary to H. pylori gastritis. The patient was started on an appropriate pharmacotherapy to treat her H. pylori infection and iron deficiency. Her anemia resolved following treatment with amoxicillin, clarithromycin, and omeprazole, as well as IV iron supplementation. This case is an example of the need to completely investigate peripartum iron deficiency anemia. Though physiological dilutional anemia and iron deficiency are the most common causes of iron deficiency anemia in pregnant women, many other causes of anemia exist, including but not limited to malabsorption diseases, nutrient deficiencies, and hemoglobinopathies. Discovering the underlying cause of peripartum anemia may be complex. However, treating the underlying cause often leads to anemia resolution. Resolving peripartum anemia is very necessary as it mitigates a variety of risks including cardiovascular disease in the mother and premature birth of the child.